is fluid and requires us to adjust to new realities. And we're happy for you to join us today because we think we have some possible solutions. But you may recall on yesterday, a company that has been a forerunner in the race for a vaccine has just put its trials on hold as it investigates potential side effects in a human recipient. The one thing that we do know for sure is that testing and contact tracing remain critical in our business community's response to the fight against this pandemic and in the attempt to keep their employees safe and protected. So our team at Chamber Benefits, Inc. has been busy looking for viable solutions to help support safe operations and to minimize business closures. Now, with that said, I would like to now turn this over to Ted Ferris, who serves as the president of Chamber Benefits, Inc. Ted.
Thank you, Beverly. Good afternoon, everyone. Let me give you a little background on what Chamber Benefits, Inc. is. So in the spring of 2019, Chamber Benefits, Inc. was presented and approved by the Board of Directors of the Greater Memphis Chamber as a for-profit entity, and in accordance with the Tennessee Business Corporation Act, was established as a separate corporation with its own board of directors. Our board of directors are Joe Durante, the general manager of Hyason, Jerry Martin, president and CEO of YMCA of Memphis in the Mid-South, Charlotte Knuckles, president and CEO of SkyCop, Inc., Dan Weddle, president and CEO of ProTech Services Group. CBI was primarily created to grow membership for the Greater Memphis Chamber by offering products and services at a discounted price exclusively, and I do mean exclusively, for our members of the Chamber. These products or services were meant to help ease the pain points our members have been telling us they've been having. It is important to note that over 89% of our membership is considered small business. Because of that, CBI board members have directed the staff to actively pursue the following products: access to quality, affordable health care, workers' comp insurance, and individual health plans. Additionally, from time to time, there are other opportunities that arise and that the board is actively considering. I do want to stress, however, that it is a directive of the CBI board to strategically not compete with our members on certain products. Now, Recover Health is another opportunity that I was discussing, and we are very pleased to be partnering with them in this fight with COVID. Beverly, back to you.
All right. Now I believe we are going to turn it over into the hands of Bobby White, who now will introduce our guest.
Thank you, Beverly. Thank you, Ted. We're very happy to have you all on the line for, again, what Beverly has mentioned is an important call. We have some individuals that we'd love to share with you from the Chamber Benefits, Inc. Perspective. We will be talking today with two individuals. First, I'd like to, we will have with us Dr. Turner Nash. He is a serial entrepreneur from the Nashville area. He's a business executive, software developer, was 2014 Nashville Business Journal Innovator of the Year, who has invested in quite a few companies and has done extremely well. He is one of the co-founders of Recover Health, which you will hear more about in just a moment. And then there's Patrick Johnson. Patrick Johnson is actually the other co-founder for Recover Health. He is a senior vice president with Meharry Medical School. He has been on the task force, leader on the task force for from the very beginning in Nashville, as they have grappled with and been challenged by, as every community has been, COVID-19, its implications and its impact. But I thought that as we talk about the work that Recover Health does and the agreement that we have signed off with CBI and Recover Health and the work they do in COVID-19 testing and the work they do in contact tracing, I thought that it would be great for us to hear from a couple of individuals from the Nashville area who, as we went through our process of using references and getting into it, we spoke to, and they were very happy to share their thoughts regarding Recover Health. So In just a moment here, you're going to see a very short video from two individuals from the Nashville area who speak very highly regarding Recover Health. If you give me just a moment here, we're going to switch to that video. All right, we will not switch to that video. We have a bit of a difficulty in pulling it up, but I'm very happy. I will say that it was Dr. Alex Jahunger, and we'll probably have this resolved by the end of the call, but Dr. Alex Jahunger, who's the Nashville czar of their task force, and also Butch Spearden, who is, I guess you would say, Nashville's Kevin Kane. He is the president of the Nashville Convention and Visitors Corporation. Both of them sharing their comments regarding Patrick Johnson and Turner Nash and the work of Recover Health and how influential and impactful they have been. So with that said, I'm going to hand it over at this point to Patrick and Dr. Turner Nash. Patrick and Turner, are you all in? Turn your cameras on, turn your microphones on. The floor is yours. Gentlemen. I think I can see but not hear. Can you turn, I'm sorry. Yes, Tanja, if you can turn the microphone on for both of the gentlemen, for Turner and for Patrick. I believe that's the issue we're having at this point. And again, folks, we're very sorry for the hold up here. But as we know in this Zoom and Microsoft Teams world, these things do happen from time to time.
Bobby, remember you have the host privileges now.
Oh my, okay, so.
If you go to Patrick's name, just add him to the panelists, and he will be able to speak.
Okay, Patrick, you've been promoted.
I think you have me on now.
All right, thank you very much there.
All right, and I'm not sure if you have Turner on yet or not, but.
Okay, we will get that figured out in just a moment here.
No problem.
We'll let you go forward.
Well, good afternoon, everyone. Thank you for having us. I appreciate you guys asking us to come and give an explanation of who we are and what we do at Recover Health. For those of you who don't know, Recover Health was founded out of necessity here in the Nashville business community. I was involved since the beginning with the COVID-19 response here in Nashville, Tennessee. And what's funny about that, I was looking through some photos probably 3-4 days ago of us in the war room, and I think they were dated very early March. And I blew up the photos, and we were keeping a track on how many coronavirus cases were happening across the world, and how many deaths and infections were happening in the United States. And they were all single digit at that time in the United States. And what a difference 6 months makes. It became a true global pandemic after that. So like I said, I've been doing this since very early stages. And one of the things that we found out in Nashville is that the business community was being excluded as we were putting together our plans. We had put a lot of emphasis and a lot of effort into large-scale public testing. We had put a lot of emphasis in making sure that hospitals within the Nashville area had enough beds, ICU units, respirators, PPE, all things needed that you didn't cannibalize the resources that you had for other individuals that had respiratory or CKD issues or anything like that. And what that eventually led to was a complete disregard, not intentionally, let me back up, of the hospitality and entertainment industry that needed frequent testing and frequent test results because they were hotbeds for the spread of COVID-19. And standing in line for hours at a time and waiting at the peak, especially around Memorial Day and 4th of July, for test results to come back longer than a week from the day that you took them was just proving to be ineffective. And so we created what would become now known as a concierge service, where we provide PCR-based testing, which is the gold standard, to the business community that allows you to do frequency of testing at an affordable rate and very fast turnaround times, no longer than 72 hours. We offer, a 72-hour window, 24 and a 48-hour window. And in some cases, depending on the industry and their needs, we offer same-day results. This has been proven to be very effective in certain industries because their demands and their needs are completely different. We also test asymptomatic patients, not just symptomatic patients. So the genesis and the birth of Recover Health was created, again, to address the needs of the business community that wasn't being addressed in large scale mass public testing, nor was it being addressed in smaller clinics that required you to come in during normal business hours that probably couldn't handle the volume of a large institute or company, but could handle 2 or 3 people coming in at a time versus testing 60, 70, 100, 300, 400 people, doing it on site and getting those people processed, tested, and results back to you in a timely fashion. So that was the reason in the creation for Recover Health. And since then, we have picked up a very large swath of the entertainment industry. We knew we would be servicing the entertainment industry, but we had no idea that so many people in the entertainment industry would need us. And that was more so a reflection of the fact that the entertainment industry now has opened up to live streaming, if you're familiar with it, where you're not having live concerts, but now they're able to go back to work because people are streaming platforms. So when an artist comes and performs, you have an entire production crew that has to be tested frequently. You have the band, you have a lot of people behind the scenes to make it happen. And they needed someone who could create a very specific COVID solution for them. And we built that, and now that has just become a big part of our business. We didn't see it coming, but that's a part of having what would be a concierge service. The same as for manufacturing or warehousing, et cetera, and for colleges and specific college programs and things that they need. So, that's how we got started, and that's who we are and what we do. Bobby, is there anything else you'd like me to cover in the specifics, or should I open it up for questions right now before we get into any specifics?
Yeah, let's do a little bit. And we see that Dr. Nash will be joining us in a few moments. Had an unforeseen incident to occur. But I did want you to talk a little bit more about your background and in terms of your work with with Nashville's task force, just in terms of the work you guys have seen and where you all are at this point. Because I think that we need to, just from the standpoint of just go back out wide for everyone to get a view of the work you all have done from the very beginning there, and even the need for the creation of the company and the work you're doing currently.
Yeah, so, early on, like I said, we started attacking COVID in Nashville in the task force, and I'm an original member of the task force, when we were just scrambling to get PPE. That sounds like so long ago, but there was a time when you couldn't get your hands on surgical masks, let alone N95 masks, and then enough surgical gowns, because you go through them when you're dealing with airborne illnesses a lot faster and quicker, and put them in biohazard waste versus if you were in a operating room, right? You can wear the same gown for, the entire procedure. When you're dealing with infectious disease, every 5 people, you're shedding your entire PPE and going into new PPE. So those are the early stages. Then it became, can you build testing capacity? And there were only 2 major labs that did that level of capacity, but that wasn't enough to handle through a state. And so we worked from managing PPE to managing throughput and testing capabilities, and changing the turnaround time from 10, 12 days, what a lab was used to a shorter amount of time, making sure there was enough volume for reagent for the test and the swab kits, and building what would be your basic everyday practice of how you deal with this happened in the first month. And then from there, you're building the process of public testing, private testing. We've had to do a lot of thought leadership. I don't want to bore anyone to death, but I'm going to take credit, even though I'm not the person on television. Dr. James E.K. Hildreth, who is the leading epidemiologist in the state of Tennessee and one of the leading epidemiologists in the nation, who built a career on this. He's like Dr. Fauci. One of the things we had to do is to begin to simplify what a global pandemic looks like, what dealing with an airborne disease looks like. That is a novel virus that we had never seen, that when it jumped from bats to humans, which most viruses, they jump from an animal to us, but it happens very rarely. And let alone have one that happens that has the infection rate of the flu. That's the thing that caught us off guard, is that it had an infection rate of 4, which means for every 1 person that gets it, you spread it to 4. And so there was a lot of education that had to take place. And that education continues, and we try to stay 3-4 weeks out so that we're letting people know of what's coming down the pipe. Finding better ways of testing. The very first tests that came out were deep throat swabs and deep nasal at the same time. Then testing got better, where you only dealt with the very deep nasal pharyngeal that went almost to your brain to get the best specimen you could. Now we've been able to get it to shallow in your nose. If you take it, it doesn't feel shallow, but it's shallow in your nose where you can get enough specimen. And now Recover Health, you've heard about the NBA using the saliva test. We now have the saliva test where we're able to do that. So technology is catching up with sensitivity of getting your RNA samples so you can get a solid test. Quick doesn't mean good. I know people look for antibody and antigen tests only. They have different things that they look for, but neither of the two look for the direct virus. Only PCR can tell you if you have the actual virus, not the antibodies or not some of the proteins that are an indicator that you have the virus. That's what antigen does. It says you have the proteins that tell you that we could probably tell the virus is in your body. PCR says, I've identified the actual virus. I can see the virus. It's here. You have it. So that's getting better with time. That will always be the gold standard. You want to know if you have the virus. At Recover Health, we try to have whatever is the latest and the best thing to indicate that for you available to you. We try to do that at least 3-4 weeks out. We're always sitting with our epidemiologists and others in the field that I'm able to constantly have contact with because of my position with the task force here in Nashville. But in doing so, again, we created a company that filled a donut hole. No one is trying to make life easier and better for the business community. The business community can't continue to be shut down every now and then because of outbreaks. It's killing our overall community. Economic community, when I say that, I'm sorry, in the United States. And so You can't stay quarantined at home forever. You can't shut down. People have to make money. They employ other people. It's a chain reaction to the ecosystem. And we felt the need to create a company that made it easier and somewhat a concierge service. This isn't for everyone. You know, our business is designed to keep the economy going in an affordable way for those who do so, like yourselves here.
Great, and that's great. I know there's a PowerPoint that you may have had to share, but I also wanted to ask regarding this. You mentioned I'd love for you to share a little bit about the app and the use of technology. I know that software development is Turner's area of expertise, and so I'd love to hear you talk a little bit about the app that you guys have developed. And even as I mentioned this, those of you all who have questions, we want to give you an opportunity to ask those questions. You can chime in or put them in the Q&A, and we can get right to you. But tell us more about the app.
Bobby, I sent you the PowerPoint, so you can pull it up at any time. I just sent it to you. I'm not that technologically advanced to even pretend to play with that. But we do have contact tracing that we provide. And let me give you a background of how and why we do the contact tracing that we do. What we found early on, before everyone knew what contact tracing was and it was a household name, this was several months ago, we knew the only way to help get that curve flattened was to begin contact tracing. And in its traditional sense, whether you're going through the public health department or you're referring to back in the early days of HIV, it is a simple person on the phone calling any infected person and saying, hey, you've tested positive. We'd like to ask you a few questions so we can find out who you've been around. Have you possibly co-infected someone else? And maybe it would help us deduce where your actual infection might have come from. That is the essence of contact tracing. And when that happens, you can say, great, Patrick, if you're infected, we're going to ask you not to go to work, but you did go to work one day before you tested positive. Who were you around? Let's let those people know that they need to be tested. And if anyone is positive, we want to sequester them, or not sequester, we want to isolate them as not to have it spread around. What we found out was a huge issue. And that issue was that people weren't answering the phone. Contact tracing in its traditional sense, 20 years ago and older, maybe even 10 years ago, would have worked. But now more and more people are used to dealing with things on their phone, being able to preview any potential message or anything like that first. So a lot of people weren't picking up the phone. If there was a language barrier, they were hanging up the phone. And traditionally, contact tracers make 1 or 2 calls, sometimes 3, but 1 or 2, and then they move to the next person. So we weren't able to track, or we haven't been able to do it effectively. And so what Recover Health has done is we have created digital contact tracing. We didn't create the concept, it's there. Other companies have put it, digital tracing together. But what we have is on your smartphone and your app, when you take a test with us, your results come to you via app. That means you'll get an SMS text message, and it'll ask you to download the app, and your results will be in that app. And if you are positive, we send out additional questions to say, how many people were you around? How many people live in your house? Has everyone been tested? Are you self-isolated, et cetera? What we found, we went from a 9% pick up the phone rate in traditional contact tracing to 17% instantly. People saw the thing come across their screen. On the second text message, we found that we jumped to 74% of people responding from a second SMS message, and then actually getting into the yes, no, and the contact tracing. And we report this out to the health department. What that has done is not so much how we report it out to health department guys. It has allowed companies to say, if Bobby, I'm going to use you for an example. If Bobby tests positive and he works at, I know it's in Memphis, so I'm going to say FedEx. If Bobby works at FedEx, but not on a particular wing of a certain plant where there are 350 people there. Bobby works in the marketing department and he's only been around 7 people. We can get to those 7 people a lot quicker. And maybe you shut the marketing department down for a day and let people work from home, versus like here in Spring Hill, Tennessee, where the GM plant had an outbreak of 14 people back in late June, and they shut down the entire 3rd shift of the plant. Think about all that production that was shut down because you just blankly said, I had to shut down because I had 14 positive cases in the entire plant, versus saying 3 of them were in marketing, 1 of them was, out on the lots, and 1 of them was here. No need to shut down the whole plant. We can isolate these people, monitor them. Those that can work from home will work from home. Those who can't, we call someone in to fill in their shift, et cetera. Is a very precise way of navigating your positive cases and managing them so you're not shutting down in large quantities, affecting your overall economic production.
That's great. So we're going to open it up for questions at this point, and I appreciate that. I think that context is very helpful regarding the contact tracing, the app, and then I think the other part to it is that it's Android and Apple. Is that correct?
Yes, we are Android and Apple. We were able to get in one of the last apps that were approved by Apple to allow that. They put a cap on it now. There's a lot of hurdles to go in to allow a company to, Apple doesn't want to allow anyone else to do contact tracing. So we got in early enough and, proved ourselves to where we were approved by Apple.
Okay, good deal. All right, we're going to open it up right now for questions. If there's anyone who actually has questions they'd like to ask, and actually, Ted, let me pitch it over to you because there are a couple of things, even while we were talking about this the other day, there were a couple of things that you brought up that I actually had overlooked in terms of context people should have as relates to recovered health. Ted, are you there?
I am here. I'm not sure which context you're talking about. We talked about.
Yeah, we were actually, there's the part about the health department dynamic. And Patrick just talked about it there, just in terms of helping to mitigate overall shutdown, how important that has been to us. There's actually a couple of news articles. I know you guys have been featured in the Nashville Business Journal. There's an article coming out tomorrow. Is it tomorrow or Friday in the Commercial Appeal, where I know, Ted, you interviewed with a reporter with the Commercial Appeal. But just the part about specifically the communication with the health department. Can you talk about that a little bit more, Patrick? You just touched upon it, but maybe talk about that, the whole idea of mitigating a complete shutdown of a business, organization, factory, so on and so forth.
Yeah, so first and foremost, our very first thing that we're going to always focus on is reporting to both the state and the city health departments, right? Because we have to track all the numbers of everyone, both positive and negative. That gives us an overarching idea of what our infection rate is and are we keeping it below 10% in the state to stay safe. And obviously below 5 is great if we could do so. The other is being able to report things to the local health department. Makes it easier so they don't come in and just shut down a blanket industry and say, oh my God, cases are up, they spiked over the weekend. When you're able to pinpoint that and say, yeah, there were 230 something extra, cases, but they were spread out in all these different places. The pictures in the news might show downtown Beale Street with a ton of people, and you might think all 234 of those came from Beale Street. But when you're able to report out every morning or every week to say, no, they actually came from all over, somewhere in Cordova, somewhere here, somewhere there, no one from the health department, or at least they have enough information where they're not going to come in and say, shut Beale Street down. All of those cases must have come from Beale Street. It's an informed decision using precise information. That's the purpose of that. And to show you how we believe it has worked, being able to do that and being unique to the entertainment industry, which wasn't our initial goal. We were trying to be unique to everyone, but it has allowed for the entertainment industry to record and film right now, because they can control and say, hey, we've only had 1 or 2 positives, no need to shut down the whole production. And they're not invited back to the Ryman, or they're not invited back somewhere else. So that type of precise, I'm gonna call it precise medicine, informs the health department not to overreach, overreact, but to be a friend to the industries, you know. And it's better to shut down one block than it is an entire industry or an entire section of downtown. Or maybe it's just coincidence that a lot of cases popped up this particular weekend, but none of them are directly tied to one gathering of people. And that's what we try to do in our contact tracing and predictive analytics.
All right,
Patrick?
Dr. Nash. I'm sorry, go ahead, Ted, please.
I was just going to say, Patrick hit the nail on the head when he said a proactive approach. That way, if the health department does come in to look at your operation, you can show them the work that you've done. If you partner with Recover Health, that they'll have the analytics that show that we have isolated the incident, and, you know, not that we don't need to shut down the whole operation. It's only in a specific area.
Yep.
Good deal. I have a number of questions that have come in. I'm going to rein these off. And prior to that, I've already introduced Dr. Turner Nash. If you can turn your camera on, Dr. Nash, I'm unmuting you here. Did I unmute you? Are you there?
Yes, I'm here. Can you hear me?
Yes, we can absolutely hear you. Good deal. All right. A couple of things. We're going to put these questions out to you all. Number one, I've received quite a few here. I want to ask you regarding this affordability and cost. We know that is potentially relative, and I know that there have been changes here and there. But could you talk a little bit about what cost of testing is and affordability, especially as we consider this is something that is being done for the private sector and concierge services. What are we talking about in terms of affordability?
Yeah, I will say this, not to sound coy. We are extremely affordable. We have great relationships with our labs. It's not free. It's not public testing, right? There is a cost associated with it. But it was designed to be married with subsidies from, you know, the CARES Act funding, so that places like the Nashville Convention Bureau or the Chamber, et cetera, would request CARES Act funding to help subsidize the cost for a large scale program if you're someone the size of International Paper, for example. But it's also affordable, that if you're a smaller business, you know, our tests run anywhere, and I know I don't want to throw out a price because the price depends on volume, et cetera, but our tests run in below $200 for organizations that are part of something like this, and, you know, above $200, but not more than $300 for people who aren't associated with large organizations such as this, to get that large scale discount.
Could you put that in context in terms of types of testing? Because I know that there are other, you know, as time has gone on, prices have potentially fluctuated, notwithstanding other methods that are kind of being introduced, and not to necessarily put a price tag on all of those, but could you kind of give a little bit more context?
So PCR, which is the golden standard test, it is the only one that detects the actual virus. Has to be done in a lab. It's an arduous process for them to test it and to figure it out. If you went to your doctor and you had symptoms, you can get tested, and your insurance cost can be anywhere from $350 to $500 for that test. If you are asymptomatic, right now no one's testing asymptomatic patients, so you wouldn't get tested. You could go to a public testing site, you know, but again, however many hours you're going to wait to get tested on any given day. You could get it back in 72 hours, 48 hours, or you could get it back in a week and a half. It just depends on how that flows. That's just the nature and the uncertainty of that publicly. Other services like similar to ours across the nation, their prices start at $300, and I've seen them as high as, for concierge service, $2,500 a test. That's just what they charge, and some people will pay that. What you see on the news, in the media, and again, I live this all day, every day. There's a new test coming out for $5. There's a new test for $15. There's a test for $40 that does this. Anything that is of that either has been FDA approved, FDA licensed, but not approved, or neither, it's not FDA licensed nor approved, is either going to be an antibody test, or it's going to be an antigen test. And antibody tests do not test for the virus. They test for antibodies in your system that might have attacked the virus at some point or another. It is not anywhere near a gold standard of what people would approve. It's there, it's on the market, and it's affordable. It's done by finger prick or blood draw. And then you have an antibody/antigen test that might make the market here soon. A lot of them are self-swab, self-prick, etc. I know for a fact that every healthcare professional that I know will tell you the rate of mistake on anything that someone does self is very high. You don't take your own blood pressure and say that I guarantee you that this is where my blood pressure is. So these tests are designed to give you ease of mind right now on the market, but the default, or I'm looking for the mess up rate, I can't think of the word, anything that is tested, self-tested right now, no matter how well you read the instructions, if I asked you to stick that thing in your nose deep enough to get a real specimen, you can't do that amount of pain to yourself. You're not going to do it. You're going to put it in your nose where it might be slightly uncomfortable and wiggle it around and think, I got a great specimen. Only a healthcare provider knows how far in your nose they have to go where that specimen, where that virus lives, and can get on that specimen. And put it in that vial, seal it, keep it temperature controlled until it hits the lab. You might get a good specimen, but what if it's someone who throws it in the backseat of their car? They're gonna go to the post office and send it off, but they stop at the 7-Eleven to go in and get something to eat. The sun is beaming down on that pack in the backseat of your car. The temperature went higher than it needed to be. No longer can that specimen be read. There's so many things that go wrong in that the price, you get what you pay for. I don't want to sound There's no way that an industry standard is this for a solid test, but someone is telling you I can do it for $5 and it's the exact same thing. We want it to be that, but it is not that right now.
Okay, we have quite a few of these that are coming in. What is the turnaround time for test results? And also, will recover immediately start contact tracing regardless of test results? I'm just giving that to you as I'm reading it here. But what is the turnaround time for test results, first of all?
We have different levels of turnaround time. We have a same-day turnaround time. I'm not sure if we're going to be able to offer that in Memphis, same-day turnaround time, but we do have next-day turnaround time, which is pretty fast that we can guarantee, and 48 hours. We try to keep it in a 48-hour window. That's pretty fast these days, and it's been consistent even at the height when it was taking a week and a half. We were always able to meet the 48-hour window for our clients. And the second question on that, Bobby, was what?
Recover in contact tracing. Just talk to us about how that works, even if, for instance, maybe just say a little bit more about contact tracing, how it works with the app.
Turner, you want to jump in on that, or you want me to handle
Yeah,
that?
no, sure. No, thank you for that question. And again, my apologies for being late. I had a doctor's appointment with one of my children, so just that important to get on this call and be with you all today. So again, thank you for your time. As it relates to the contact tracing, it is optional. So we can have an employer that wishes to implement the program, which basically means that when we report out the results, the person goes into the phone, they log into the app, and they begin to answer self-questions or self-health questions about, did you have a fever today? Were you around anybody? And those data points are what we collect over time. Now, it relates to the physical tracking of people. There are some limitations that we are bound by according to the government in doing that. So what you'll see in the news is Apple and Google have really stood down on doing that currently. They have the ability to do it, but it's not something that's readily available to the public. What we tend to push in our program is you can report the people that you've been around, and with their phone numbers and their systems, we can also contact them that way. There's no physical tracking of the phone, but we do have access to the data and the people who have, quote unquote, pop positive enough to where we have the information to contact the people that they've been around. I'll also add that Google and Apple are no longer allowing just a random casual business owner to develop any sort of COVID contact tracing app without a partnership with the Department of Health or a research university, which I believe we were one of the last people to obtain. A very rigorous process. So to answer your question, it is an option for you to have contact tracing, but it is something that we recommend you use as an employer as one more step to collect data to make sure that your human resource management and your physical plant management are actually they're manageable with the information.
Thank you, Dr. Nash. I want to have a question here. Do you charge per, I'm going to just kind of rapid fire here between the two of y'all. We have about 16 minutes left here, and we have quite several other questions. Do you charge per call? Is there a monthly minimum inclusive of the app? Do you charge, and this is pretty much all in the same question. Do you charge per call? Is there a monthly minimum? And that's inclusive of the app. Those are all questions here. Love to hear your response.
All right, let me try to take that one, Patrick. So again, we're not physically calling anyone unless you're positive, and we'll have our physicians to call you with next steps and what that looks like. Should you get retested, you should quarantine, all of those other things. We found that using technology allows us to reach people more quickly because 95% of the population has a cell phone or some mobile device. So all of those messages are going out via the phone so that we don't have to worry about whether we caught you or not. When you take a test, 2 weeks of that contact tracing is included in the price. And I believe for CBI, we've contracted it somewhere around $165 per test for a 24 to 48-hour turnaround time. So again, it's included. We recommend that you use it. It's your option not to use it. Hopefully that answers your question. If you have any additional questions about that, please feel free to reach out to us. Next question.
Handling multi-state entities. Now that is two things. Talk of handling multi-state entities. Let me pull this back up because we have this from another. How do you handle multi-state entities, and how does reporting integrate with their health departments? I think that what might be a little bit different about Memphis as opposed to Nashville is just our proximity. So I would just mention those two things.
Turner, I'll handle that. We've never actually dealt with that, and now that I think about it, you have both Arkansas and Mississippi right at your borders.
Right.
We collect data and information based on your zip code and your where your residence is, and we report to those health departments as required. Ours has always been the state of Tennessee. If you are in Tennessee and you are working in Tennessee, we would definitely have to report in the state of Tennessee. But if you live in Mississippi, I guess we would have to. It's not difficult for us to do. We'd have to shoot that same information over to the Mississippi Department of Health so they can at least say, because you're living there, we have X amount of positive cases in the state. So we do all of that. That's just part of what we're required to do by license. and we've never had that issue, but if someone resides in Arkansas or Mississippi, we will contact those departments of health, as well as the Shelby County Health Department and the state of Tennessee.
Okay. Asymptomatic, symptomatic patients, what is the approach? Is the testing just for, from the business perspective, you guys, this isn't the public sector, so I think I'm answering the question for you, but go ahead and just answer that, speak to that.
Yeah, we test asymptomatic as well as symptomatic patients. We do not turn you away if you're not symptomatic.
Okay, good deal. I have, we got that question. Dr. Nash, we wanted you to give just a little bit of your background. We didn't have the opportunity to hear from you a little earlier. Just give a little bit of your background. Patrick did that a little earlier. We have a couple of minutes. If you can take a minute and a half or so just to give us a little bit of background so we can get a better context regarding your work.
Sure. I'm 46 years old, married for 22 years, father of 3, 17, 15, and 13. I'm a family man first. I got into being an entrepreneur about 25 years ago, built several successful businesses. My most recent one was an education technology firm that I sold back in 2017. Went on to work for that firm as an executive in the telecom business. Retired last year. I own 7 other businesses, mostly around technology and how we disseminate information quickly via technology. This actually has a very large vein in that sense, where a large part of our solution is making sure that people get information quickly and accurately. I also have, and I could go through the list, but it'll be a resume that I send you out. Basically what I'm saying is I'm 25 years as an entrepreneur. I understand what businesses are going through in these very difficult times, and it was my goal and our goal with this particular venture to make sure that we can help our business community that doesn't often get the first round of relief. So of course we've seen where in our city, the schools, the health departments, and all of these places that naturally would require the resources to help everyone doesn't necessarily help businesses, because businesses aren't people. And I feel like only through the lens of another entrepreneur can we identify quickly and try to address those needs. So 25 years of being an entrepreneur, successful, I brought those skills to this particular venture, and I'm looking to help my community. That's where this all started.
That's great. I have a question here from B. McBride. His question is, in terms of where do you go locally to have the test done? I want you all to kind of explain your model, because I think that will be helpful for everyone just to know a little bit more about how your model works there in Nashville in terms of this white glove service being offered to businesses there in Nashville.
So our model is set up here. We have a physical location here in Nashville, in the downtown area, in the healthcare district. A clinic that's large enough to take, a nice volume of patients to come through. But again, we were built as a concierge service. So our model is that we come to you, built on your specific needs and your volume and the timing of what you need. It makes it easier. It keeps the cost somewhat affordable. That way, it allows you to have the results, just as Turner mentioned, and the information that you need coming directly to you. Although we haven't established in Memphis yet, again, this is part of the rollout process with the chamber, is to provide this service in Memphis. You guys have, large scale companies, and you have smaller companies like we have here in Nashville. If you are a large company, for example, it would probably be best for us to either set up a satellite office inside your facility that's open a certain amount of hours where people can come through as they need, or have targeted times and dates where you're saying, I want to do 10% of my workforce or whatever percent of my workforce on this day or these multiple days, and then I'll call you next month, etc. We build it to your needs. And for those who don't need it like that, we would have either mobile services or a physical location where you can either come to that physical location and get tested, or where we have mobile, where we'll say for a hotspot, we're going to be here. The week of X, we'll have testing people at this location between these hours. You can come get tested there. The following week, it might be somewhere else. We haven't determined what that looks like, fixed site and mobile in Memphis yet, but as we get closer to making this a reality, we'll do that. But right now, we've seen the best traction in being concierge, which pretty much is moving in and out as needed within the infrastructure of particular companies and organizations.
Okay, great. All right, this is great. There are a few more questions here. I did want you to, relative to the testing, love for you to talk about what this looks like with you all being in Nashville, how this operates in Memphis. So I think maybe that is just talk about that, please.
Yeah, well, we would come in and actually build an entire team that is Memphis-based. That would be local to Memphis, that would be staffed by people in the area. It's just easier, more economic that way, with oversight from, you know, our company here until it gets up and going, so that there won't be a lot of back and forth, you know, up and down the highway, except for the movement of the tests, whether they're going overnight or however they're couriered. But the operation will be a Memphis-based operation.
Yeah, and that's also the idea. I want you to also speak to the fact that your labs, you're not just relegated to Nashville in terms of lab space, that these are labs where you have space, labs in different places.
We have labs, we have lab relationships throughout the state of Tennessee. We also have labs in neighboring states. We do that because, as you know, in the summer, you couldn't buy lab space anywhere. And come November, late October and November, it's going to be the same thing. Like when flu and cold season hit, we're going to see a rush of cases and needs for testing. So you got to have enough throughput. And so we use labs that are close by that, you know we can get our results back in 48 hours of sending it to a lab, 72 at the absolute most, which is still within an ideal time frame.
Patrick, this is the last thing here, and then I think we might be able to cue and close out. I think one of the concerns that we have had has been that, you know, in Tennessee, I know things that we have not seen what other cities have seen in terms of upticks. But based on, you know, the relationship you guys have there in Nashville and the work that's being done, you know, I'd love to hear you talk about why this testing is so critical and contact tracing is so critical even now as we come out of Labor Day, knowing that, you know, we might see some eventual implications of Labor Day associations that people have had. But we're going into schools opening, and you know, just talk about just the importance of COVID-19 testing right along through here, based on where we are in this pandemic.
Yeah, so it's easy to take your foot off the gas. If you go back and you follow from the inception of, say, December, January, when this was happening, it wasn't until late February, March that America admitted that it had a coronavirus issue before we were even naming it COVID-19. It goes in ebbs and flows. And late spring, early summer is when everyone felt the panic of, oh my God, it's not just New York City. It's trickled down to other cities and states. That was the first time we saw that, because everyone was ignoring New York at the time. Oh, it's not gonna come here. And what you realize is that the infection rate will go up, it'll plateau a little bit, and then something else will trigger it to go up again. And a lot of that is apathy, where we refuse to wear masks, we refuse to social distance, we think the numbers are under control, and then it takes one or two people that are infected to infect 28 people within an hour because we let our guard down. The problem that makes us think it's not important is it takes 3 weeks for a cycle to hit. So Memorial Day hit at the end of June, believe it or not. Like everything that we did in and around Memorial Day hit us in June. It takes that long for the cycle to begin to infect people, those who are going to be symptomatic, to have the symptoms, those who will be hospitalized, to go to the hospital and then begin to have a strain on the hospital. And that ran through 4th of July and carried longer because we still had the 4th of July holiday where people were ignoring it and gathering. Well, as it crested out of that, we were like, oh, it's all over. We're saying that now. This virus technically shouldn't have spread that much in a warm season. Viruses don't spread in warm seasons. We're about to go into our cold season. We didn't flatten the curve, we just slowed the curve down. There's a big difference in that. It's not on its way down, it's just not climbing right now. So we think that there's not this reason to be alarmed. But October, November, the weather changes, flu and cold season take heed, and this coronavirus is of 29 in the 29 in the virus family. It's going to spread like the rest of them. This one just happens to be deadly. This one happens to be more infectious than SARS or MERS, but it's just as infectious as the common cold and the flu. So it is a false sense of security if we think that we've beaten this because the month of August wasn't a bad month. September will be a neutral month. October, November, December, and January are going to be terrible months for us. And I will end with this. The only way to fight a virus that you can't see is to see it. And the only way to see it is to get tested. If you are tested, you know you have it and you don't co-infect your loved ones. You can self-isolate. You can go to the doctor a lot sooner if you feel in a way that you normally don't. If you're not testing yourself frequently enough, you might infect your loved ones who might have comorbidities and that will die from this. Right. Just because you're young and strong does not mean that your grandmother or your aunt or your father that you bring home and you might be asymptomatic, you give this to them and they have underlying health conditions. Right. You know, you're the cause of it.
Well, listen, Patrick Turner, we definitely appreciate you all coming on. We appreciate everyone for listening in. There'll be information that we share out via email with you all, as well as that elusive video with our folks out of Nashville, our friends from Nashville. And we look forward to hearing from you all as we work together to speak to this pandemic, this challenge. And we appreciate the Partner Recover Health partnership.
Bobby, do you want to mention the price? Could you please mention the negotiated price? I don't think I did that you guys have with us. I didn't.
Yeah, at this point, in terms of the PCR, I think that we've spoken at being right there at 160, 165. I think the other piece is that the other testing apparatus and other items are testing. I know you guys just got the saliva test, so those things could change or fluctuate depending on how the market goes, right? So we're happy to be in contact with you all and look forward to hearing from you. And also know CARES Act funding, there's been a proposal put forward for us to receive funding that would allow us to defray some of those costs for local businesses. But again, you'll hear more in the newspaper tomorrow, and then we have a call tomorrow. But we look forward to speaking with y'all. Ask you to reach out if you have any additional questions. We'd love to make that connection with Patrick and his team, and appreciate y'all for joining on. Have a good afternoon.
Thank you, guys.